Okay, so today's lecture is going to be over chapter 6. You already have your books out and such, so let's go ahead and get started. We'll be referring back to some of the other sheets, so keep everything out to look over those. We're going to be talking about the nervous system and some of the different branches of the nervous system. This is just sort of a repeat lecture of some of the things we've covered before with the nervous system and the different divisions of that. We spent quite a bit of time talking about the central nervous system already. We've talked about the peripheral nervous system some, but we're talking about that in more detail today. The somatic nervous system deals with regulation. It's going to regulate a voluntary function, so it's going to say, so if you need to move your hand or move your leg or something, then that's where this is going to come into play. This deals with all the conscience functions, so that you're actually aware of you're doing what you tell your body that you need to do. Again, we're talking about regulation. It's all about regulating. Now, next term we'll talk about the endocrine system a lot, and we'll talk about the different drugs that control affect the endocrine system. But this is one thing that regulates the endocrine system, because we're also talking about involuntary function. So if you need to release more insulin, you don't tell your pancreas, okay, I need to release more insulin. Your pancreas just does that automatically, right? Also, your heart muscle, your heart beats. You don't tell it, okay, beat, beat, beat. It does that automatically as well. And the same thing with food. Your food moves through your digestive system, and it's just a process that it does. You don't actually tell it to do that. So we're going to divide this again further into sympathetic and parasympathetic, and this is where that chart is going to come into play at. Activation of the sympathetic nervous system, and let me refer to the chart a little bit here. So if you look at your chart, you see on the left-hand side, you see the parasympathetic nervous system. On the right-hand side, you see the sympathetic nervous system. Is everybody with me? Okay. So along this, we've got we're talking about this. So talking about increasing your heart rate and that fight or flight, that is going to be the sympathetic nervous system when you activate that. What counteracts that is the parasympathetic. So it's almost like a seesaw. When one goes up, the other goes down. And and your body normally tries to regulate this so it's nice and even. Except when it's time, when something happens and you need to activate the sympathetic nervous system, the 3 F's, fight, flight, or fornicating, the sympathetic nervous system then kicks in and is activated until the parasympathetic nervous system then tries to calm that down once the whatever is over. This goes into a little more detail, but this is exactly what we looked at with the chart or with the picture. We talk about the sympathetic nervous system. If you look at we were talking about dilation of pupils, the increased heart rate, breathing, etc. You see it's inhibiting digestion. The reason for that is we're diverting all of the energy from digestion to other organs and other parts of the body, because digestion is not an emergency situation. So if we need to run, we need our energy in our legs so we can get out of there. So we're taking that away from the digestion. Now, you'll see it says stimulate release of glucose. Glucose is fuel, it's energy. So that's why it is releasing of that glucose. Okay. I just covered all of that with the chart, so moving on. Parasympathetic nervous system, that is on the left-hand side. That is just the opposite of the right-hand side. So again, slow heart rate. We're not going to be breathing as fast. So everything that the sympathetic nervous system, it's the opposite with parasympathetic. So all this we just went over a moment ago. So not that it's not important, but we just went over it, so it's still important. again, activation of the parasympathetic decreases the heart rate. Just mentioned that. And it restores the functions before that fight or flight took place. With parasympathetic, here they had the comment of rest and digest, because you're not in that state of activity. You're in a state of rest, and during that state is when you do your digestion. We have already talked about the different neurotransmitters in a lot of detail. You have that neurotransmitter chart. Make sure you look at that neurotransmitter chart. That will help you tremendously on the final. We have been talking about neurotransmitters in chapter 6, 7, 8, 9, 10. So that neurotransmitter chart I gave you, make sure you look over that. That is a very good summary of the different neurotransmitters, what they do, the conditions, that kind of thing. So make sure you look over that. This just goes and discusses or shows you the different neurotransmitters. We've already talked about that, so I'm not going to beat a dead horse. The acetylcholine, epinephrine, and norepinephrine we've already discussed, so I'm moving on. Very quickly, discuss a couple of these. The acetylcholine, we know it's a neurotransmitter that's chemical, and that is going to be at the junctions of the autonomic nervous system and also of the skeletal muscles. So when that muscle needs to do something, that acetylcholine is going to be the one to activate that. More about acetylcholine, where it's released and what it does. Preganglion neurons of the parasympathetic nervous system and sympathetic nervous system. These are just different areas where this acetylcholine is going to be released. Since there's something up here that we have not already mentioned. We've already talked about the motor neurons to the skeletal muscle. That makes sense with acetylcholine. And also we talked about acetylcholine with Parkinson's disease. That may be a good way to reference it here. And I think I'm good with that slide. Here we're talking about the different receptors and the response to those receptors. This is also in your book on page 94. Notice we have alpha 1, alpha 2, beta 1, beta 2. Now let's talk about some of these. Our beta 1 is going to be located in the heart and kidneys. This is important for next term, because we'll be talking about medications that will be affecting specific receptors and what the specific receptors do. So we'll be focusing quite a bit on beta 1. But beta 1 is found again in the heart and kidneys. Beta 2, if you want to focus primarily on the, and the way to remember beta 2, think of lungs, you have 2 lungs. Take a look at the muscles, specifically in the lungs, and also the liver. Then if we look up at the top, we see alpha 1 and alpha 2. We'll primarily be looking at alpha 1. Let's take a look at a couple of the slides, and then I'll refer back to that and talk about some drugs. Let's see, norepinephrine, epinephrine. I've already talked about this quite a bit in the past. You should be very familiar with this. Talking about the different receptors, the peripheral nervous system consists of adrenergic receptors and cholinergic receptors. And then we divide those into subsets, and those are divided into the different characteristics of whatever that response is. So, for example, do we want to block something? Do we want to activate something? And what we're looking at is going to be this alpha and beta. We'll talk a little bit about the epinephrine, norepinephrine next term when we talk about the cardiac system, along with alpha and beta as well. I already mentioned this from the book and from the chart about the alpha receptors divided into alpha 1, alpha 2, beta is divided into beta 1, beta 2. You know where they're located at, you know the responsibilities of those receptors. Next term we'll be throwing drugs at these receptors. Well, we throw some drugs today, but we'll be really talking about those drugs next term. So let's take a look at these drugs. There's also in your book, on page 95, adrenergic drugs. For example, let's take a look at albuterol. That's probably the most common one here. Albuterol is a bronchial dilator. The mechanism of the drugs is going to be to activate or stimulate the alpha beta adrenergic receptors, and this is going to be located in the smooth muscles.
Does the numbers make a difference?
What do you mean?
Like the one.
Like,
The one.
well, yeah. If you look back at the thing, it depends upon what you're trying to hit, what you're trying to attack, because for example. Coreg. Well, Coreg affects both alpha 1, beta 1, beta 2. So we're affecting all three of those receptors. Now, so if a patient had asthma, for example, we would want to stay away from beta 2. So Coreg would not be a good drug to put a patient on because if they had a history of asthma. Mm-hmm. It could. What did you say again?
Nothing now.
That's what I thought. Specifically, we're talking about albuterol, for example. That's going to affect beta 2. That's going to affect alpha 1. That's going to affect beta 2. Okay. Let's take a look at something else on this table I think is interesting. Take a look at, let's see if it's in here. Take a look on page 96 in your little pharmacopoeia. Okay, on 96, about halfway on that page, you'll see decongestants. Let me talk about two of these things. First of all, let me talk about Sudafed PE. That phenylephrine stuff. Does everybody see that? Now, keep in mind that the active ingredient for Sudafed PE is phenylephrine. Now take a look on in your book on page 95. Look toward the very bottom. You'll see 5 up. You'll see phenylephrine, and the brand they have here is that neosynephrine. This is what they give you in the hospital to raise your blood pressure, because it is a vasoconstrictor. Does everybody see that? It's in your pharmacology book. It's 5 up. Phenylephrine, the same stuff they give you in the hospital to raise your blood pressure. So if your blood pressure is dropping and they need to raise it, neosynephrine, because it's vasoconstrictor. However, notice it's the same stuff that's in Sudafed PE. Pretty interesting, huh? Now, right below that is our pseudoephedrine, and then if we look in the book right below phenylephrine, we'll see pseudoephedrine, and that's the brand associated with Sudafed, and that's what we typically think of as our nasal decongestant, which still can potentially raise your blood pressure, but not as much as the phenylephrine stuff. I'll talk about that a lot more next term as well. But I'm surprised. I was surprised when the phenylephrine went OTC as Sudafed PE. It's much better at raising your blood pressure than it is as a decongestant, but nevertheless, it is what it is. So, since both of those are a vasoconstrictor, which receptor do you think it's going to be hitting? Alpha 1 or alpha 2? It's going to be alpha 1, right? See here on our board? These are going to be our alpha 1s. Vasoconstriction. Okay. Moving on, lots of uses with the drugs. Here we're talking about specifically with a vasoconstrictor. So this would be an example. This would be an alpha 1. So it's going to be to take care of the hypotension. You would give a vasoconstrictor, such as the alpha 1. Excuse me. It would constrict the blood vessels, making them smaller. Blood pressure goes up. Makes sense, right? Make sure you can draw this. You may even want to write alpha 1, then maybe pitch those 2 drugs underneath it that we talked about. You can write the brand if you want to. I would prefer generic, but if you wrote brand, that's fine too. But We talked about what pseudoephedrine and phenylephrine. We talked about those two, so you want to write those two down or on your thing. They're what, vasoconstrictors. Also here, an alpha-1 used to treat hypotension, and part of that is used to relieve nasal congestion. Part of the mechanism of action. Adrenergic receptor drugs that affect the beta receptors are used to treat asthma, bronchitis, and these are going to be bronchial dilators. You may want to put beta 2 here.
So alpha ones are beta constrictors and beta twos are
Right. And beta 2 is, we're going to be looking at that with also with a bronchial dilator as well. Right. So think of beta 2 as dilation. Be that a the lungs. Okay. Adrenergic blockers, most commonly prescribed class of autonomic drugs, and these are effective on both the alpha and beta receptors. We'll take a look at a couple of these. So if you look on page 97, these drugs are effective in either the alpha or the beta. So let's take a look at page 97 for a moment. See how the drug ends in OLOL? Okay. If it ends in OLOL, that means it's a beta blocker. Notice that the drug ends in, if the drug ends in SIN, actually OSIN, that means that it is a alpha blocker. So if it is OLOL, beta. If it is OSIN, it is alpha. You write that down? So it doesn't matter which drug I give you, look at the ending. The ending is going to be the indicative of what drug that is. So I'll give you any drug that's on this chart and ask you, if it's beta or alpha, and all you have to look is the ending. If it is OSIN, it's alpha. If it's OLOL, it's beta. Okay, so adrenergic blockers reduce delivery of catecholamines and adrenergic receptors by disturbing the catecholamines synthesis, storage, or release. The use, lots of uses. We'll go into quite a bit of detail about the uses next term, or specific drugs with certain indications, but the big picture is going to be here. So we're looking at hypertension, we're looking at certain arrhythmias, chest pain, angina, pectoris angina, heart failure. We'll be slowing the contraction of the heart down. Making the heart last longer, etc. Okay, cholinergic drugs mimic the actions of the parasympathetic nervous system. So remember, that's the one opposite the sympathetic. So this is our rest and digest, right? Some of these drugs increase the concentration of acetylcholine at the cholinergic transmission sites. And some will inhibit the stimulate voluntary muscle fibers, preventing that muscle from contracting or doing whatever it needs to do, either voluntary or muscle fibers. Some examples. This is your book on page 99. And these drugs can be used to treat glaucoma, and we have some anticholinergic or cholinergic blockers. So, bless you. So cholinergic receptors located in, we've already talked about this, lots of places, parasympathetic, some of the sympathetic, autonomic, involuntary. Therefore, cholinergic drugs may affect both divisions, sympathetic and parasympathetic. So let's take a look at some of these. Page 100. Page 100, table 6-6, very bottom there. These are some anticholinergic or cholinergic blockers. Let's take a look at the first one, atropine. Atropine increases the heart rate, right? Now, atropine actually works on one of the cranial nerves. Did you discuss cranial nerves in terminology? Maybe touched on it. So atropine actually works on one of the cranial nerves. It's the vagus nerve that it works on. So again, just want to point out that we're actually so we're still affecting the nervous system. Cholinergic blockers acted by selecting or blocking the response to acetylcholine. So cholinergic blockers block the response to acetylcholine. And the mechanism of action, they depress the central nervous system. And some of the uses with the Parkinson's, and some of the things they do or suppress all the following: sweating, salivation, secretions from the nose, mouth, bronchial. So it help dries those secretions up. And some medications here going to be used to treat GI disorders. They may also be used for general anesthesia, bradycardia, which is slow heart rate, and some medications during CPR. So, for example, the atropine. Could give atropine for bradycardia as well.